Three very common signs that you might have diabetes. Now, there are a lot of signs and symptoms that go along with being a diabetic. However, these three in particular happen to every diabetic, so it's important to be aware of them. This way, if you are developing these signs, you can see your primary and get your diabetes under control as quickly as possible, because the diabetic patient tends to destroy silently every cell in their body. Sign number one, losing weight without dieting. If you have a normal caloric intake, yet you're constantly losing weight, there's a potential that you've developed diabetes. You see, diabetes is a problem with the insulin. You might not be producing insulin at the pancreas, or that insulin could be defective. You may have gained a lot of weight and now you have insulin resistance, or the receptors required for the insulin to work are not working properly. Insulin takes glucose and puts it into the cell. You see, our cells run on sugar, and that's what the glucose is. So with a problematic insulin, if you can't get the glucose into the cell, your cells are basically being starved of their life energy. So even though you're eating, you're technically starving. Number two, increased urination. When you have high blood sugars, you tend to change the osmolarity of your blood, and your kidneys become instructed to try to get rid of that offending agents that increasing that osmolarity. You start passing sugar in the urine and bringing water along with it. You see, sugar acts like a diuretic. Just like if you take a water pill, you'll make more urine. When you have high blood sugar, you make more urine again. And that leads to symptom number three, excessive thirst. You see, all the urination leads to a partial dehydration. That, coupled with that increased osmolarity that I talked to you about. You know, when you go and you eat a high sodium meal and you start to develop a thirst and you can't seem to quench that thirst for hours to come? Same thing with having a high blood sugar. Your osmolarity changes and you develop an insatiable thirst. That's also coupled with the fact that you're urinating more. So if you have any or all three of these signs, I would recommend you go to your primary and get checked for diabetes. It might be a very simple thing to control. Remember, diabetes affects 30 million Americans alone, with approximately 85 million pre-diabetics. Worldwide, we have approximately 537 million diabetics. So it's a common ailment, and it's important to find out early if you're developing it, because early treatment leads to less long-term complications. I'm Dr. Messina, and if you do like my medical and aesthetic videos, click subscribe, hit the bell for future videos, and have a good day.